This is the cisternogram. And so what we're going to be actually looking at, these dark areas here, this is the choroid, these are the lateral ventricles.
The dark.
Yeah. The cerebral spinal fluid is made there and then it's pumped out into the third ventricle, and then it goes around the brain. And then when it comes back, it goes into the basal cisterns. Who remembers how CSF gets reabsorbed?
It's reabsorbed by the corpus.
Because, you know, the thing is, if you see radioactivity in these dark areas, you've got hydrocephalus. Okay? In other words, what's happening is the pressure is so high, it's forcing the fluid back. It's flowing backwards instead of forwards. If it's flowing forward, it should look like this. It should look like, you know, at 4 to 6 hours, you should see the pitchfork sign.
Where does it get absorbed? The CSF?
Yeah. No, well, no, what happens is it gets reabsorbed in the arachnoid villi. Okay? What happens is that it kind of just sort of hangs out here. Okay, here's the cisterna magna down here. Okay, these are called the Sylvian cisterns. I guess now they're called the lateral cisterns. Over here on the lateral one, you see this big clump up here, that's called the supracella cistern. So you have the cisterna magna, you have the supracella cistern, here are the transverse or Sylvian cisterns here. Okay. But what happens is that it just gradually gets reabsorbed through the arachnoid villi and gets put back into the circulation with the jugular veins. So it mixes with the blood that's gone into your brain. What actually happens is the choroid plexus removes materials that it needs to make CSF from your blood. And then after the CSF makes its trip through the spinal canal and comes back, it gets reabsorbed back into the blood. And then goes back into the mid-sagittal sinus and then into the jugular veins and back into circulation. But over a period of time, we should see it spreading out over the convexities of the brain. Okay? This is a normal scan here. But on the next page, I think there's one.
What's the imaging agent for that cistern?
Indian ETPA. Okay, here's an abnormal one. See, you don't see the pitchfork, but what you do see are the ventricles. So the pressure was so high, it pushed it back into the ventricles. Okay, so this is hydrocephalus. Here you can see the lateral ventricles. Here you can see the fourth ventricle. This is actually a pretty bad one. When you see all of the ventricles like that, that's not good. And then it persists. So notice, one of the things that you're supposed to do is you bring the patient back 4 to 6 hours after the injection, and you should see that pitchfork sign. If you don't see it, then you need to take a picture of the injection site and determine whether or not the stuff actually either got into the subarachnoid space, or sometimes patients may have fractures or tumors or something growing in the spinal canal that block the flow. So you need to rule those two things out. But the thing is, if after 4 hours you don't see stuff going up into the brain, then you need to find out why. Okay? The other thing is, whenever you do this procedure, you always want to make sure that you don't let the patient raise their head up. You always try to keep the head down lower than the rest of the body, because at least until the pressure builds back up on the inside of the subarachnoid space in the brain. Because we don't want the brain getting sucked down into the bottom and you become a politician. So, it happens. Okay, well, I'll tell you what, we're going to let you go 10 minutes early today. Don't tell anybody.
What's our quiz going to be on?
Let's take a look. Oh.
No quiz.
No quiz because we have to finish.
Yeah.
Yes. I think what I'm going to do is I'm just going to, I won't give you a quiz next week.
How nice.
But I did give you a lot of stuff to study.
Oh yeah, we have to study for the final.
Um,